regulatory. So one thing should be clear by now, cannabis is highly complex. The regulatory environment is ever-changing, and we need to be differentiating our products against it, and success is most likely to achieve by being meticulous about identifying potential risks and opportunities, and by being always up to date with the latest regulatory developments. And this is something we're going to talk about today with three acknowledged experts. On the right-hand side, we have Mr. KAI-FRIEDRICH NIERMANN. He's a specialized lawyer for HOMBERG Cannabis. Kai is a member of the CAN-BAR Association, the Association for the Cannabis Lawyers, and working with cannabis companies across the globe. And Kai puts his energy to sustainably establishing the cannabis industry as one of the most significant industries in the future. Then we have Alexander RIEG. Alex was one of the first entrepreneurs in Germany to get active in medical cannabis. He founded KAI in 2017, and he was also a founding member of the German Association for Pharmaceutical Cannabis, the BPC. And then we also have Mr. Peter HOMBERG. He's a partner at Dentons and focusing on life science with more than 30 years of experience. And he's the head of the European Cannabis Group at Dentons. And he's one of the most renowned lawyers in Germany when it comes to cannabis and a thought leader in regulatory matters, especially in regard to medicinal cannabis. So, Peter, let's get started with you. What are the biggest regulatory uncertainties and challenges producers, importers, and wholesalers of medicinal cannabis face? And can you give us a quick update on the medical cannabis ecosystem? What are the latest changes in legislation and jurisdiction when it comes to the status of medicinal cannabis?
Yeah, Eva, thank you so much for the kind introduction. This is a very long question, and I can actually speak for the next 3 hours about the regulatory environment within Germany and Europe. But I would like to touch on just three matters, which just, I would say, in the last couple of months are coming. The first one is with respect to the production and the producers. There are a lot of new producers coming up, in particular in Europe. We have heard that this morning already. Producers coming from the European Union, like Spain, like Greece, and other countries. But there are also cultivators in other countries outside of the European Union who would like to get their products exported into Europe and into Germany. They are currently facing a significant issue, which is receiving their EU GACP certification for their products. Those who are outside of the European Union need to have an inspection, on-site inspection of the facility in order to get the EU GACP certification by the respective authorities in Germany. As due to COVID, currently we have travel restrictions. We have a long list of different producers in countries outside of the European Union who are waiting for officers coming over to their site and to get the respective EU certification. And we will see, hopefully, once COVID has been to a certain extent overcome, these authorities traveling. The importers, of course, have an issue with regard to consistent quality. And I've seen the chart just now with respect to where to grow and how to grow. I'm not an expert in growing. But from my point of view, and I've heard from our clients, is that indoor growing is at least the basis for a steady quality, which can be much more easily achieved under these certain circumstances of indoor growing than in greenhouse or even outdoor. And with respect to the German monography, with quality provisions regarding cannabis, the THC content should not deviate more than plus minus 10% from the registered product, which is a challenge for the producers, and even some producers who are currently exporting into Germany may have difficulties to really reach this plus minus 10%. And last but not least, the wholesalers, we have heard this morning already, they are or confronted with a price erosion. I would say it's a price reduction, and not a price fight right now. The respective agreement between the Health Insurance Association and the pharmacies to fix the price to a maximum of $9.52 per gram of flowers. It was an indication of a certain price control, and we see that more. Even this $9.52 per gram from the wholesaler to the pharmacy is not technically really achieved at this point in time. We have seen rebates from various suppliers and wholesalers which have a significant impact and have reduced pricing significantly. I think these are the three issues which I just want to touch on the regulatory side.
Thank you very much, Peter. Maybe to Kai. Kai, what do you think, how strong is the need for harmonization in regard to hemp and cannabis? Like, what role do legal proceedings play in this when it comes to harmonization?
A big role, a very big role. Never underestimate the power of litigation, I would say. If you look back in history, in 1996, there were the last reform in Germany when it comes to cannabis and hemp. And then we had a stillstand literally till 2017. And 2017, Germany legalized medical cannabis, but only due to a private patient litigating his right for home grow. And the court accepted this right and granted him the option to grow his own medical at home. And then the federal government said, no, we doesn't want that. We don't want the patients to grow their own cannabis. It's too much of a distress for society, for police, for everyone. We make a law, we legalize medical cannabis. And that was a milestone, of course. But in regard to hemp and recreational cannabis, there's still a stillstand till 1996. We had 2017, the last elections. The last elections, and the Green Party were negotiating with the Liberals and the Conservatives for a coalition, for the so-called Jamaica coalition. These coalition negotiations lasted 4 weeks, and then the Liberals said, no, we don't want to govern because we could govern falsely, so let's do not govern at all. And then the Green Coalition came in place, and another stillstand. So the last 4 years. But then we saw two important decisions by the courts, by the ECG in November 2020, saying the cannabis case at stake was CBD e-liquid, and the ECG said no, CBD has no psychoactive properties, and the French government couldn't prove any health risks for the population, so they said it's free movement of goods. The principle applies here, it's legal in Czech Republic and it has to be legal in France as well. That was also a milestone from the court. And then we had the HOMBERG case here in Germany in March this year, because law enforcement said you can't give away any hemp product to the end consumer for consumption purposes. That's not allowed. And everyone else said from the business side and lawyers, that's wrong, you know. There is no misuse with the hemp possible. The Federal Court of Justice said then, okay, you can give it to the end consumer, which is a very big change, was a very big change, but still the question of the misuse of intoxication is not clear right now. So that's why we decided to start a procedure on the principle of free movement of goods. We applied for a general decree for a client of us because the CBD flowers are very popular here in Germany. CBD flowers, they are legal in Luxembourg, Austria, and Belgium. So if they are legal in these EU countries, they should be legal in Germany too. And we applied at the Federal Office for Consumer Protection for this general decree. It was dismissed, this application, and so we started yesterday, 2 days ago, we filed a lawsuit to the Administrative Court of Braunschweig, hopefully that the court will say, okay, it's a matter of European law here, but even better would be if the next election outcome would be that we have another reform and liberalize these regulations.
Thank you, Kai. Alex, let's get a question to you. What do you think, what are the most important questions farmers should ask themselves before entering the German industry? From a regulatory point of view, can you tell us something about the ecosystems that are in place here?
Of course. I think it's very important to understand that the hemp market and the medical cannabis market are totally different. So you should always be aware that you have to prepare as well as you can before entering the markets. Because there will be a lot of struggles, or there are still struggles entering the market, and I think it will take some time to regulate everything. It's getting better and better since 2017. Now we have a regulation, and you should be very well prepared because you need a long breath, and it's not like running a sprint, it's more like running a marathon entering the market. And yeah, for example, the medicine market, you also have to face a lot of questions regarding or from your local authorities, Bundesopiumstelle, and registering the products. And I think this is now more regulated than the hemp market, in my opinion. And yeah, so you should always think about that it takes much longer time than you expect. Yeah.
So Alex just said it, there are two different things. There's hemp and there's cannabis, and within all of that there's CBD. Peter, CBD, lifestyle or medicine?
Well, if you look into the CBD market and into the regulatory environment regarding CBD products, you can actually sell CBD products in 3 different sections. One is cosmetics, including which includes CBD. The second one is food supplements, I'll come to that in a minute. And the third one is a pharmaceutical product. So with regard to cosmetics, the respective rules and regulations of the directive for cosmetics of the European Union apply, which are not that strict. However, you have to be careful with regard to the CBD to be implemented into the CBD product, because the German Narcotics Act sees it's much stricter currently than in comparison to the European directive. Here, the European Court of Justice decision, which my colleague just mentioned, may help in the future, very clearly stating that CBD is not a narcotic. This has not been yet implemented into the national laws. It has to be implemented shortly, but at this point in time, the German Narcotics Act has not been changed. With respect to the food supplements, I think that's clear. The European Commission very clearly confirmed that these food supplements which contain CBD need to be registered under the Novel Food Directive of the European Union. So we have currently around 40 or 45, maybe today 50 respective applications for food supplements pending to be recognized as novel food, which includes CBD. And last but not least, with regard to medicinal products containing CBD, you need, as we discussed this morning in the first panel, market authorization for these products, with clinical trials, etc. So you have to be careful if the borderline between food supplements, cosmetics, and medicinal products is the medical claim. If you have a product, for example, which is a nice food supplement, you have works with it, but to put in a medical claim, as I've seen it this morning, one of our clients using a cosmetic which has CBD and claiming it has a health, or is improving your health condition to a certain extent, like it's helpful for skin inflammations, that would qualify that product as a medicinal product. And then you need to have market regulation. So the CBD market is currently difficult. It's moving forward with the help of the European Court of Justice. And this definitely is an advantage, I would say.
Thank you. Kai, what would you say in all this regulatory crazy Durcheinander, as we say in German, what will the elections play in terms of cannabis reform, and what factors could limit or destroy the success of ongoing cannabis reform?
Yeah, the elections will play a big role this year. We are at a decisive point in time here in Germany, as I mentioned before. There were still stand over 2 decades almost. And this year Germany has the chance to start reform in all 3 areas of cannabis. And at the moment it looks like that this reform will take place, because when the final results of the federal elections will be clear at the 26th of September, so in 4 weeks' time. We will see that we will have a new chancellor, a new government, a new coalition, new parties, and in every constellation, at least one party, probably 2 parties, are for complete legalization of cannabis, for recreational cannabis, and all parties, even the CDU, agreed at the end of the last term of the Bundestag that there is a need for hemp reform. So there will happen something, and it's urgently, because we saw law enforcement actions since January, really strict and powerful law enforcement actions, even against hemp leaf tea traders. Hemp leaf tea has been on the shelves in Germany for decades, and law enforcement decided early this year also to go after hemp leaf teas, because it's cannabis and it's not processed, and from the dogmatic standpoint it's comprehensible to have it clear and to go also after these products, but they are harmless, you know. Hemp leaf tea is a great product, and we see that with everything. You can make a discussion of everything. Is a CBD product, is a supplement, is there THC in it, is this THC content enough to be a narcotic? Then we have the ICBC ruling, which helps, but there is a strong need for cannabis reform, and I hope that the new government will also take early steps right after the new government came in place for decriminalization. Is a very important point. That should be the first measure of a new government, and then we can agree on the rules for recreational in the next 2 years. But decriminalization would be a big advance, a big step. And then we can talk about model projects or full legalization, and how the rules will work on that.
Can I just add, Friedrich, the hemp tea issue is really currently on the spot. We are representing one of the largest herbal tea producers in Germany, and they had a wonderful hemp tea in their portfolio, and got a cease and desist order from the leaf farm not to sell it anymore, for 2 reasons. Reason number 1, it is against the law to sell it B2C, and secondly, it has a psychotic effect. So it was from pure hemp, no THC in it, definitely no THC in it. But what actually happened, I think 0.1, less than 0.1%. What really happened was the federal court actually decided B2C is possible. Oh, my clients thought, oh, that's fine. But then they are using an expert witness who actually stated that if you use the hemp tea leaves and put that into cookies and bake it, it may have a milligram, but it has a psychotic effect. And then the court decided, okay, you have to take that from the shelves. That is something which is kind of strange, and we hope that this is going to change, in particular with regard to hemp, because industrial hemp, as we all know, has been on the shelves, have been sold for a long time. So this shows this heterogeneous environment which we are facing in the different areas of CBD products, hemp products, and THC.
So maybe just quickly back to Kai. Kai, how would you say, if we get cannabis regulation for recreational cannabis in Germany, how would this affect medicinal cannabis and hemp products here?
Well, of course, this would be would cause a boom, a green rush. Hundreds, thousands of companies only dealing with recreational cannabis, thousands of jobs, tax revenues, and ancillary businesses taking care of the product quality and consulting services. That would have a great impact, of course. As our panel before discussed already, the medical cannabis industry will probably get not a problem, but they have a natural advantage in the market because of the option of reimbursement that the public health providers. But then they will have to focus really on medical purposes and the studies, and then we need more evidence and more clinical trials, clinical studies, designation areas where patients can rely on. The normal patient probably would go to the recreational market and get their medicine for their own therapy there. But the market will open up. We have 600 to 800 tons of dried flowers to the black market, in the recreational black market in Germany alone. So there's lots of potential for that if we have a clear legal framework how to sell and how to distribute recreational cannabis to adults.
But I think that both markets can coexist, because the first one is the recreational market and then it is regulated in another way, and the second one is that the patients get the costs covered by the public health insurance. So maybe the medical cannabis market will be a little bit smaller, but I think both markets can coexist.
For sure, yes, but then of course the public health insurers probably ask, why should we pay such a expensive therapy? Just go to the next cannabis partnership around the corner. But yeah, you'll see.
Still, I think we should not underestimate the need for a doctor when you're a sick person. So I definitely also think that medicinal cannabis will still exist, even though we have a regulatory environment for recreational cannabis. But let's talk about regulatory environment in the European Union. Basically, we have a free trade union here in the European Union, unless we're talking about cannabis. Peter, what possibilities do you see for regulatory harmonization at an EU level?
Yeah, I think we need to go back a little bit in history. And you may ask, what is he having? What kind of papers does he have here on his ship? And this is a resolution of the European Parliament dated 13th February 2019, which calls the European Commission to harmonize the European legal environment for the use of medicinal cannabis. It has not been re-recognized. This is the initial step forward for creating a EU directive, which needs then to be implemented in the respective legislations of the EU member states. It has been, when it was published, celebrated by the trade press as, yeah, we're going forward. Probably nobody has read it completely, but if you look into those 18 different points, I would like to cite just 2 points to make you understand where the danger of this resolution is. Point number 12 reads as follows: calls on the member states to reconsider the relevant legislation on the use of cannabis-based medicines when scientific research proves that the same positive effect can be achieved by using ordinary medicines that do not have addictive effects. Oops. That is something which is totally contrary to the development which we have currently in the market. And the number 14 is even worse. Calls on the Commission to work with member states to ensure that safe and controlled cannabis used for medicinal purposes can only be in the form of cannabis-derived products that have gone through clinical trials, regulatory assessment, and approval. Which is not yet the case, as we all know, because cannabis products currently are sold as extemporaneous mixtures in Germany, and the pharmacist is going to do a patent manufacturing step before he hands it over to the patients. So there is no regulatory approval necessary, no marketing approval necessary. And as such, this paper is kind of dangerous if the EU Commission will follow and implement the respective directive on that. So the industry has to work against that, has to work with the Commission in order to have an environment, a regulatory environment throughout Europe established which is for the industry and not against the interests of the industry. When this will be implemented, well, nobody knows. COVID has, of course, slowed down each and every process at the European Commission, and they are not as quick as you know, in general. But there's a process going on, and we have, as an industry, to put forward our interests and to lobby the interests of the respective industry.
I can only agree on that. It's in each and every one of our responsibilities to lobby for policy and to be there and to work together as an industry so we can get a more harmonized and also operatable regulatory framework where our interests are reflected in and we're not there taking decisions that we have to work with then in the end. So we're almost at the end. Like, I have one last question for all the speakers. What is your personal message to all founders and investors having a look at the cannabis regulatory environment? Maybe Kai, you can start.
Yeah, look at the rules, stay compliant, but don't let them overvalue if it's too confusing or if it doesn't make sense to fight back.
Nothing big to add, and I think you should have very long breath, and you have to fight.
Make yourself available with the heterogeneous regulatory environment, not only within Europe but also within Germany. Different states has different views, as you heard this morning, on what cannabis products are. It has an impact on your business, and of course on any of the investments. And as such, make yourself familiar with all these different and heterogeneous regulations.
Okay, great.
Do we have time? We have time. There's a question right there. Look, he's so excited. I want a couple of sheets. Here we go.
I've heard some rumors floating around that Germany's going to limit the import of non-finished cannabis into the market here, as in non-GMP cannabis. Has anybody heard about where that conversation's landing, or if that's moving forward?
Yeah, we have indeed currently a route of cannabis products which are just GACP processed into Europe and into the German market as well. Products are then here refined under EU GMP certification and then sold into the market. The authorities are looking very closely into this route because of patient safety, of course, is something which is top on their list. And we'll see how the authorities will react, but they are watching it very, very closely. And the question is also whether these products which are imported into the European Union and then later into Germany, we know one producer from Uruguay via Spain into Germany has really only GACP process. There is kind of a gray zone regarding the drying process. Pre-drying is allowed under GACP. Really, a further drying process is GMP and would then require GMP certification. So, and if you have a product which arrives in Europe, which has a humidity of maybe 20% or less, that might not be GACP processed. Only GACP processed. This may be also a GMP process, which of course would need certification.
And is that the entire EU that's looking at that, or is that Germany specific?
Currently, I know that the German authorities are looking into that. In particular, some of the lower pharmaceutical authorities in the various states where the importers are located.
Thank you.
Any more questions?
You're so informative. Apparently, you've taught them everything. So let's hear it again for the whole panel.
Thank you.